Hello, everyone. Thank you for coming for this very interesting, I hope, session. And so today we'll concentrate and we'll try to cover AI and what's happening with AI in digital mental health in Israel and digital mental health in general. And so just I'll give you a very brief outlook. Scientific foundings over the past few decades have shaped our understanding of the underlying neurobiology associated with psychiatric diseases. However, despite significant advances in research, there is a widespread disappointment with the overall pace of progress in detecting and treating psychiatric disorders. So current approaches to diagnosis of psychiatric disorders largely rely on physician-patient questionnaires, interviews, and most of the time they're not really accurate and objective. So diagnosis is not always objective, and so they're quite inaccurate and ineffective in providing a reliable assessment of symptoms. And these limitations, however, be overcome by applying artificial intelligence, hopefully, to electronic medical databases and health records. So AI in psychiatry is a general term that implies to the use of computerized techniques and algorithms for the diagnosis, prevention, and treatment of mental illnesses. So over the past few years, we have witnessed an increase in the use of AI in healthcare and in the medical practice in general. But its role in psychiatry still remains a very complex and unanswered question. So here we will, on this panel, we will try to cover very few interesting startups here in Israel who are focusing on digital mental health and trying to find new means for diagnosis and treating psychiatric disorders and helping people to cope with certain mental conditions. And so here we gathered 5 startups who are in the field, and I will just introduce you. So on my right is Alex Gomberg, who's head of clinical operations at the XR Health, and he's also practicing psychiatrist. Would you... Psychotherapist, sorry. Yeah. Oh, physiotherapist. Oh, my bad, sorry. So would you like to say a few words about yourself?
Hi. So I'm Alex, like she said. And I'm a practicing physical therapist. I've got an MBA in healthcare innovation, and I do my best to make healthcare move into this next age where we can do telehealth and use the tools to both scale and take care of the population, do better services than before while still keeping it human and providing the benefits that we used to have. And I believe we can do that with the tools we have.
So, my honor to introduce you to Alex Frenkel. Alex Frenkel is clinical psychologist and VP, and this time I'm right, and VP product at Kai Artificial Intelligence, a very prominent Israeli startup showing great results. Just as I compared it previously in our conversation, sort of calm on steroids. So just please say a few words about Kai.
Thank you. So I majored in clinical psychology and practiced for a few years and then switched to tech. Kai is my second startup, so I'm co-founder and CEO. And in between I was with product at other companies like Taxi and Kobu and in other companies. And Kai is a very unique combination between psychologists and psychiatrists and product builders, engineers, data science experts. So Kai is a conversational AI. We're focusing on younger people, on supporting teens, adolescents. There's a huge need and pain for teens. There is a rise in rates of sadness, depression, anxiety, even suicide attempts, unfortunately, are rising. And there are not enough human therapists, and therapy is not accessible enough. And with Kai, we'll try to build an AI-powered companion, make sure that everyone has access to the best tools and the best practices, and everyone can get this first line of defense support. That's Kai. We're a consumer company. Almost all our users are in the US. Kai is only English right now. Hebrew is very challenging for the AI, but maybe we can talk about it later.
Sure. So on my left, my pleasure to introduce you to Nadav Askari, who is the CTO of a very prominent Israeli startup, Genetica Plus, and Nadav will say just a few words.
Thank you. Thanks for inviting me. So my name is Dr. Nadav Askari. I'm the Chief Technology Officer of Genetica Plus. Genetica Plus is a biotech startup in the field of precision medicine. And our aim is to try to match the right antidepressant drug to depression patients out of dozens and dozens of drugs that are out there approved for use. The sad truth is that when treating a patient with depression, the doctor must choose from one of those 70 drugs, and the practice is typically through trial and error. And the first line of treatment works with only about a third of patients, meaning that 2/3 are left non-responsive to the drug. And so what we try to do is to match the right drug through the use of various types of data that we collect from the patient, so to match it to the specific patient. And we'll talk a little more about that later. So thanks.
Nadav Bitton from Frenkel. Yeah, you don't hear me? That's not working. So Nadav Bitton from Frenkel, a very prominent also Israeli startup, was already running clinical trials, and they're in the field of post-stroke. And just a few words about the company and yourself.
Thank you for having me. I'm Nadav. I'm a neurologist specialist. I'm a physician. I worked throughout COVID in the various hospitals in Israel. And one of the things that Frenkel is aiming to do is basically take this huge task, this huge problem we've got in the world that is a lot of our patients are having a problem, specifically currently subacute strokes, and we're trying to rehabilitate them, bring them back from a patient who was basically outside of the entire social. He's outside of his family. He's very debilitated. Can't move. Sometimes they can't. Their self-esteem is very hurt, and we created a treatment protocol and device that helps them rehabilitate and go back into society and into their family and back to work.
Thank you. So I'll just say a few words about myself. I'm the CEO of a company developing a novel and unique solution. It's clinical decision support for psychiatrists. We help psychiatrists and psychologists, social workers to diagnose depression in a better way and to monitor the progress of the treatment. So we just prepared you a very simple slide just to show you how the mental health transition happened. So if we just compare mental health technology to language learning solutions, we would have been in the era of CDs and tapes phase, like about a decade, in the past decade. So now the shift from language textbooks to CDs, sort of, when people had access to various audio courses over internet, but still they were not flexible, so they were not dynamic and they were not customized. So this is sort of the era now digital mental health is in. So in a similar way, mental health too, just companies rebuilt the traditional model of care, provided of directories and marketplaces in a digital way, like Headspace, Meditopia, Calm, expanded how and when one could practice meditation and mindfulness and build massive businesses. So on-demand therapy platforms like Talkspace and BetterHealth allow patients to virtually find and visit therapists. So these were very important indeed. Market expanding initiatives, and they allow people on demand, virtual care, meant that many users could get access to local providers or providers in other geographical area where they didn't have the access. Yet still these platforms were and are quite expensive, about $150 to $300 a month, just the subscription fee. And most of the households cannot really afford it. So here we gathered together to speak of the opportunity of really bringing all the best what we can get from the AI and virtual reality and novel devices which can measure and transmit telemedicine and report the doctors, allow them to monitor certain treatments, how we can really bring it closer to the patient at more affordable prices. So we'll start with Alex review and Kai AI, just tell us how it works.
Yeah, so okay, so Kai it is very unique because you don't need to install anything. There is no app. Kai connects on messaging platforms. So Kai would be a contact on WhatsApp or iMessage or Telegram or other messaging platforms. And you just start a conversation with Kai. And the way Kai works is by providing this basic support and toolbox for everyone. So Kai would help you practice journaling, gratitude, reflection, pausing during the day, being present in the here and now, but also tools from cognitive behavioral therapy. So things like observing emotions or creating a distance between myself and my thoughts. Practicing meditation is a good example as well. And the magic is that it's available 24/7. So anyone can say, hey Kai, I'm having a challenging day, and Kai would be there and be able to respond. And the big challenge with AI, with building AI, is obviously the data. And there are different ways to try to build AI. One of them is to do a lot of research and build algorithms in the lab. We decided to do the other way around. So we started from day one with providing Kai to actual users, actual customers. And the more people engage with Kai, they teach it, and it becomes a bit better, and it's able to support and understand more situations and more scenarios, and that's the way it improves, basically. And the conversation builds my personal dashboard. I can track my progress. And maybe the last thing I want to mention before passing it back, the AI is very, very good in assessments, in running questionnaires, in saying, hey Alex, it's been a while since we did a checkup. How are you feeling today? Let's do a well-being assessment, and it can say we see an improvement from the last time that we did that. So that's also very, very unique for the AI, and obviously the data allows us to generate research and basically try to measure, does it actually help? And we have good initial results showing that it helps on tools that are used to measure the efficacy of therapy in telehealth or in person. So the results are very, very promising, and still it's very early. We have now 60,000 users. Tens of thousands of teenagers are engaging with Kai every single day. So it's super exciting and very, very early. So that's Kai. It's KAI. .ai. It's super simple.
We can look it up online?
Yes, you can connect. It's completely free. Yeah.
It's actually a great app, really, because teenagers are now communicating via WhatsApp, and it's almost impossible to talk to them. And actually, there are already applications which know how to get certain words out of the text of the WhatsApp and find out if and figure out if teenager is in a risk of suicide. And actually, as a startup in the U.S., they save tens of thousands of lives a year just by monitoring the WhatsApp when they sort of, instead of calling here in Israel, usually people call Iran or helplines like of that kind. So there, they can teenagers can text to this service, and the service knows to find out if really the teenager is in danger, and they send the ambulances, and really in the past 3 years they saved tens of thousands of lives. So while Kai helps us with self-management techniques and helps us throughout the day and manages and directs us and our emotions, Alex will tell us about the XR Health, which actually helps us and patients in hospitals be in, as virtual reality actually helps patients in hospitals and regular people just to cope with reality.
So thank you. And like the previous Alex just said, there's two of us Alex here and two Nadav, so we're it helps remember the names. So XR Health, I failed to mention a bit earlier, we do virtual reality. That's what we do. And we provide it in two different settings, one of them being as a telehealth provider, which is what we do mostly in the US and Australia and here in Israel. That's the bulk of our activities. We provide therapy via Zoom remotely so people can get care and any kind of treatment they need from the comfort of their own home, which is something that's part of Health 3.0, getting care where you need it, when you need it. So that's one thing we do. And at the same time, we send patients our virtual reality devices at home so that people can get care, for example, from a mental health professional, and at the same time practice mindfulness in a virtual reality setting. And they'll be able to use any kind of setting. So they could be looking at butterflies while doing guided meditations, or swimming with dolphins, or climbing Mount Everest, or doing guided breathing, or even doing exercise for physical rehabilitation. Because like I said, I'm a physical therapist, and for me, the physical aspect is no less important. So if I want a patient to do home exercise, and compliance is generally fairly low, the likelihood he will actually do those exercises and enjoy them consistently are much, much higher if they're fun and gamified. Sorry, what? Yes, so we also gather that data and we use machine learning and get better and better at providing the care that actually helps that specific patient. We ask them how they're doing, and we actually use machine learning on our own data to get better and better at that care. So for example, you'd be able to follow a dragon with your neck instead of just moving your neck from side to side, or pop balloons with a sword in your hand, or run around and exercise in a way that feels like a game and not like a chore. So we're trying to make it feel human and attainable and fun at the same time. So that's one aspect of it. Now we also work a lot with hospitals, mostly here in Israel, with some operations in the US as well. For example, in Rambam, there's a department where we're partnering with Takeda, who are funding for the chemotherapy ward for patients that are currently undergoing chemotherapy to use mindfulness tools in virtual reality to make the entire experience much more manageable and pleasant. And we use tools like mindfulness and exercise from the realms of CBT and ACT and the likes to do guided breathing and meditation for those kinds of patients. We're also available in a lot of different care settings for occupational therapists and physical therapists throughout the country. And there's a lot of studies for burn victims and other conditions where you can alleviate pain for painful processes. For example, changing a diabetes, mashavat insulin, or changing bandages for a burn victim, stuff like that. So that's a lot of the things we do at XR, and we're constantly developing new features and so on. So we know from research, not just our own, that virtual reality helps with compliance. It makes things more fun. And we know that a lot of kinds of therapies that are usually very hard to do are a lot easier in virtual reality. Because, for example, a person who has agoraphobia and is afraid to go outside, you can create exposure to an environment like that in their own home in a safe setting. And a person who has a fear of movement and pain in his shoulder and doesn't want to move, you can make him do that in a way that's actually going to make him move without any fear of movement in a safe context and environment. And we can also limit the range he'd be required to. For example, since it's an FDA-regulated medical device, the software, we can set that person's shoulder range is XYZ, or these are the topics we'd be discussing with them. So it's very customizable. And we provide those services to provide even better care. So it's not just remote, it's even better in some ways. So that's a lot of what we do at XR.
Oh, thank you very much. So while XR Health helps people to cope with reality and stick to physiotherapy or whatever therapy they need to be, or help them cope with certain disorders by establishing certain or creating certain reality, they will be able to do so. BrainQ is a company which actually helps neurologists to monitor, to diagnose and monitor post-stroke conditions, and they do it remotely, which is very interesting. And Nadav will tell us a little bit about this.
Thank you. So what BrainQ does is we take the basic elements of the brain, and when I say basic elements, I mean the neuron, right? The building blocks of the brain. And we know today that to do even the simplest task you can think of, maybe move the finger, your brain has to communicate that through a number of neurons, each speaking the same language, right? Eventually saying, move the finger as like that. And so after stroke, a lot of things, since these neurons are damaged post-stroke, these communication patterns, these talking neurons don't exist anymore. They died. And now these previous patterns, this chatter that the neurons used to speak, we learned how to emulate them. We used an EEG to extract these different frequencies and intensities. The brain is always talking, and we were able to take healthy patients and compare them to post-stroke patients. And then using these differences specifically for each and every movement, so for this movement, for that movement, for talking, for emotions, for depression, which is a very major post-stroke event, pathology, and we took each and every one of these chatters, communications, and we codified them, so to speak. And the idea being is that once a patient had a stroke, we identify the type of stroke he had, the type of disabilities he has now, and then we re-implement that type of chatter, that type of frequencies and intensities, electromagnetic frequencies and intensities, and we re-implement them. We bathe the brain, so to speak, with these magnetic frequencies. So now what we know is that once a brain is damaged in whatever way it may be, so stroke, traumatic brain injury, Parkinson's, Alzheimer's, depression, each and every one of these conditions is a sort of change from the norm, is a sort of difference from a human being who doesn't have these events. And what we also know is that post-acute illness, like stroke, for example, or like traumatic brain injury, the brain is very primed. He really wants to get better. And we can see that with the patient's rehabilitation curve. Once a patient has a stroke, he always drops down a certain degree, and then he starts rehabilitating, even without any treatment. Problem is that rehabilitation is really, really limited. So limited, in fact, that most patients after stroke, they progress so little that we almost consider it negligible, sorry. So this combination of events, right? So our ability today to know what is that chatter that should be happening in a healthy brain, combined with that post-stroke, damage to the brain, where the brain is really eager, wants to relearn what he just lost. That combination of events is where we get in as BrainQ. We step in, and we apply our treatment to those patients. And we've been seeing remarkable remarkable results so far. And we have now embarked in a multi-center study all across the U.S., about 15 sites all across the U.S. I have fun flying from one side to the other. And we're now doing it with 150 patients to show a proof of concept, and hopefully get the FDA by 2023.
Thank you.
Thank you.
Thank you very much. I think it's an amazing device. Just imagine, someone who had just a stroke, they don't need to go to hospital anymore. They can wear a very comfortable device, all that they had. They need to wear it just 40 minutes a day. And all the data is gathered and transmitted to the physician, or whoever's responsible for the treatment. And they get update every day, and they know how the patient progresses. and they just don't need to go to the hospital, especially for post-stroke patients. It's quite of a hassle. You know, they need someone to take them there. They need someone to be with them there. And here it's just they eliminate it, and really anyone can do it from home. And I even would assume even a better care, because what happens is usually doctors, and you're practicing neurologist yourself, you know how it goes. You have 20 patients waiting, so you don't have enough time. You can't really measure progress, and so you just, that's disappearing sometimes. So you just, you speak to them. Again, this is an interview and very subjective assessment. So here we really have a revolutionary device which hopefully will change lives of millions of people. Well, and the last but not least is Nadav Askari, and Nadav is presenting Genetica Plus, and this is also a great company who they're trying to help us, the entire humanity, cope with depression, which recently in the post-COVID era is just not even a silent epidemic anymore. It's really taking all over the world, and if in the pre-COVID era, the only 11 to 15% of the US population were diagnosed with anxiety, now it's over 40, and some sources say even more than 50, and suicide rates among teenagers and men especially is just on the very high rise. So depression is just the new, probably one of the most serious diseases which are threatening humanity, and Genetic Plus is helping us to find the right way to treat this disease.
Thank you, Ina. So indeed, depression affects 300 million people worldwide. This is a huge number according to the World Health Organization. And Genetica Plus tries to help that by matching the right antidepressant drug to depression patients. I mentioned earlier 70 different drugs that are out there, but although there are so many drugs, the matching the right drug to each patient is the tough part, because not every drug affects every patient. And so our task and our goal is to do this match between the drug and the patient using AI and using machine learning. The company was founded by Dr. Talia Cohen-Solal, who's herself a Ola Hadasha from the UK, and she co-founded the company along with Dr. Daphna Leifenfeld about 3.5 years ago here in Jerusalem, and we just 6 months ago on a successful round A, we moved to Tel Aviv, where we're presently located. So how do we do that? How can we match the right drug for depression patients? So what we do is we collect 3 types of data, 3 pillars of data. And the first one is pretty trivial, patient history. We take data that relates to patient history, family background, and other clinical data. In addition to that, we also take the genetic background of the patient. Now, there are some what we call pharmacogenomic companies out there trying to match those depression drugs to depression patients based on their genes. But so far, the success rate of those pharmacogenomic companies has been no more than 50%, only 50-50. So what we're trying to do on top of patient history and pharmacogenomics genetic background is to also add, and this is what makes us really different, is to also add the patient's neurons. And obviously you cannot reach to the brain and take a biopsy from there. So what we do is we take a blood sample and we convert the cells from the blood, certain types of cells, to neuronal cells, to the right neuronal cells, those that actually respond to psychiatric drugs. And so these neuronal cells are grown on a dish in a lab. We call it brain in a dish, just because these are the same neurons in the brain grown on a dish. And we treat those cells with the various antidepressants in the lab, and what we can do is we can monitor. We were able to monitor changes in those neurons, in those neuronal cells, changes in their plasticity, morphology, connectivity, and other attributes that actually differentiate responders versus non-responders for antidepressants. So we collect all that data, the patient history, the genetic background, and the brain in a dish data that I just mentioned, and we integrate that into our algorithm, which generates a list of the drugs, and and it gives a score for each drug based on the relevance for the patient. So this is why it's precision medicine or personalized medicine, because it really is specific for each patient, because the samples are taken from the patient. So, and we hope, and we've seen early results in our labs to support the very high accuracy rate predicting the right antidepressant for each patient.
Thank you very much. So that's been about all. And if you have any questions on any topic, yes, please.
For Nadav, who just spoke, is this something available in Israel now for patients?
So,
how much do it cost, and how do people reach you?
So thanks for that question. We're still in R&D. We're still in research and development. We are planning to open our new facility, our clinical lab, actually in the US. This is our market. However, we're now conducting a clinical trial with Sheba here in Israel. So if someone wants to be part of this clinical trial, they can, and I can give the details later, of course. Of course, if they meet the criteria.
So if my son's psychiatrist is at Sheba, he would know about this?
He might. You know, we work with a psychiatrist from Sheba. Her name is Dr. Revital Amiaz, I think. Yeah, so that's the status of this product now. We plan to launch the product by mid-2023, so within about a year or so from now.
Thank you. Yes, please.
Two questions about XR Health, Alex. First question, what are the technical limitations to therapy, virtual reality?
Could you elaborate technical limitations? How would you define that?
You currently have a product. Do you imagine something more advanced?
Yes. So the question was, what are the technical limitations and the future technological advancements we hope to gain with XR, right? So we already have a device and it's already used in a lot of clinics and hospitals across the globe, mostly US, Australia, and Israel currently. Yes, we currently partnered with Pico to create the current hardware for the XR, which is fairly bulky. We partnered with HTC Vive about a week ago, and they invested more than $10 million in our company, as well to partner with a smaller virtual reality device. It's about the size of your glasses. And once it's much more accessible and easier to use, it gets better. So for example, originally using our device required more than 20 decision points and clicks from a user to use, which was a barrier to entry. Now it's less than 5. So we're hoping to get to the point where a person can just put it on and a therapist already has the treatment plan for him and they can just put it on and use. So hardware is one thing. Integrating with medical data systems is another, for example. So I can work with clinicians at hospitals so they can provide telehealth from the hospital long term. So a patient discharged from the hospital could keep exercising at home. That's something we hope to gain as well in the future, and I believe we'll make it happen. You can also collaborate with different multidisciplinary teams. So that's something we do already as a telehealth team, but if we're able to provide for a patient that's undergoing physical therapy and, for example, exhibits anxiety, I'd like to be able to connect him to a psychotherapist as well if he wants it, and get him other tools to do that. So that's one aspect, the hardware aspect, and the clinical aspect, also the software. So we want to create better software that's more personalized, learns the patient better, and has more options. For example, for exposure therapy, to be very specific to that patient. Let's say someone's afraid of dogs. If I can expose them to dogs in VR, that would be great. There's really great research for falls in the elderly in the US right now. Some with us, some not. The showcases using virtual reality for fall prevention actually helps expose people to those situations and improve outcomes. So there's a lot we can do with hardware and software and clinical changes and incorporating into medical teams and hospitals, and there's a lot to grow. That's my point. So thanks.
You said you have another question, or was that?
The other question was, could you elaborate on like the different research that you had mentioned, like beyond compliance? You mean that people actually do the exercises?
Yes.
What other benefits are there that you've seen?
So it's important to note that XR is a tool, so it depends what you do with it, right? We have a lot of evidence that virtual reality in general has improvements for patients in compliance, and it's much easier to exercise when it's a game and it's fun and it's in a context that's safe and comfortable, and especially if it's inside your own home, you don't have to travel. For certain patients, that's better. In terms of the actual evidence, it depends what you mean. For example, I know that for physical therapy, exercise that's done in virtual reality has much better compliance and better clinical outcomes in terms of range, pain reduction, strength, stuff like that. So we know there are actually better outcomes when you use tools like that over standard care. For psychotherapy, it depends. I don't think currently we're at the stage where we can replace a therapist. I don't think we even intend to. But it's an addition to the tools that they already have to let the patient manage the condition a bit better. For example, we have lots of patients out in the world using mindfulness recordings or other tools, and getting the ability to use that in VR as well adds another dimension. So it's not that we plan to say that VR can solve the world's problems, it's that we're going to do whatever it is we can, do it best. And also you use virtual reality when it provides an extra benefit. So it's not VR for VR's sake, it's the best care we can provide using the tools we have.
Excellent, thank you. And please.
It's awesome what you're doing with depression, but I'm wondering if it could also expand to bipolar, schizophrenia, other issues.
That's a wonderful question. I'll just repeat it. So the question was, can we actually expand our platform for other mental health diseases? And the answer is definitely yes. Our plan is to actually, depression is only the first mental health disease. And then our plan is to actually take this platform and expand it to exactly those diseases that you mentioned: ADHD, schizophrenia, and bipolar. Because there's a need there, but also because our platform can actually support that. Because once we know how to take those blood cells and turn them into neuronal cells, then we can treat those cells with essentially any drug, any antidepressant, or any psychiatric drug, and then we can simply assess that. We do need more data for that, of course, but definitely this is on our pipeline for sure.
Yeah, question here.
The two people on AI. First of all, do you visualize a movie called Fantastic Voyage? You know what it is? It's an old movie. It's a scientist that shrunk with a tiny submarine and was, yeah, okay. So what I want to come to this, Civil 70. Yes. So, as a physical therapist, the proprioception is an essential part of healing. I have gone through a very serious accident, broke a vertebra in my neck, and I healed myself by knowing what I was doing. I utilized THC to increase the amount of proprioception. So I could really travel in my body mentally and know what I was doing, what I was facing. So I found this exercise. I'll get you my book on exercise afterwards. Anyway, what I'm thinking of is to use virtual reality in this direction, to take a person let's say you have metrics, you're moving the articulation so many degrees, so you have goals and gamify the whole thing. Okay? Tell me what you're doing in that direction.
So thank you for the question. I'll explain to people that don't know what proprioception is, I guess. The sense of where the body is and its joints and location in space. Right. Let's call it your body shape, sure. Where your body is and how it's moving. So there are advances in that regard as well, some with us, some with others. Essentially having feedback on what you're doing and how well you did or not.
Haptic devices, haptic globes.
Yeah, so haptic feedback is one of the ways you can do that, for example, by getting feedback on the activity. Visual feedback as well, audio feedback helps. Even some devices have
virtual reality environment.
Virtual realities.
They can actually manipulate whatever they want.
Right, the metaverse is about using tools like that as well, that's very true. So there's even thoughts in the future for, I don't know if for us, but in general there's a lot of talk about incorporating more senses than just hearing and seeing. So you'll be able to get feedback on touch, feedback on smell, and any other sense, including balance. And the better feedback and the more realistic it is, the more effective it is in care. Because we know that the more the environment is realistic and contextual to that patient, the better the outcomes are. So yes, there's definitely going to be advancements in the incorporation of people into... Right, using avatars is one of them.
There's a doctor, Camilo Ricordi, who is the head of diabetes. I developed. There's Dr. Camilo Ricordi, who is the head of diabetes at Miami University. And he has an avatar created by a company I work with, which is called Synthrive in San Francisco. And the avatar is AI-endowed, transaction capable. He's right now training this avatar, teaching it all he has discovered in his career, so that when he's dead, people will be able to ask him questions. So.
Well, thank you very much. So, we have two last questions, yeah? No time. Oh, sorry, so we just can come to the presenters and ask them directly. Thank you very much for your attention. Thank you.
Thank you so much to this wonderful panel. I would like to invite everybody to stay for our closing words. It's about 15 more minutes if you'd like to stay and join us.
Sorry?